It's your eye health experts, Prevent Blindness Texas, and welcome to Eyespiring, a conversation about all things vision and life. Welcome to Eyespiring with Prevent Blindness Texas. I'm your host, CEO, Heather Patrick. Today, we are super excited to have Dr. Kathleen Murphy join us. But before we get there, I'm going to tell you a little bit about Prevent Blindness Texas and what we do. We are a public health agency focused on vision and overall health and connecting people to the care they need and helping people understand why eye health is so important as part of their overall health. It's a critical step to ensure that you are living the best life you can have. And that's why we're here to support everyone across the state in their eye health needs. All right, so with that, as I said, I'm Heather Patrick. I've been here for about 8 years, but I've been in the public health space for about 20, give or take. And one thing that always stands out to me is the need for education and empowerment and advocacy. And so another thing that we really believe in is advocating for change and access and giving people, those that don't have a voice in this process. And so that's one of the reasons we do all of this and why we have these conversations so that people can learn and know where to go and who to call and why eye health is so important. So with that, I am super excited to introduce my friend and mentor and role model, Dr. Kathleen Murphy. So let me tell you just a little bit about her and then I'll turn it over to her. She is professor and associate dean for global health and community engagement at UTMB School of Nursing. She is also a fellow of the American Academy of Nursing and a certified global nurse consultant. So with that, Kathleen, tell us more about who you are, and then we'll get into some of the questions that we have for you.
Okay, well, thank you so much, Heather, for that introduction and for giving me a lot of titles I didn't know I had as far as mentor. So thank you for that. It's been an absolute joy to work with you since I've had the opportunity to work with you, and I appreciate you inviting me today. There's really not a lot to tell about me. I'm actually kind of an average person, probably just like everybody listening to this podcast right now. I come from a very large family, Midwestern family, and some of what you talked about with advocacy and that sort of thing was instilled in us at a very, very young age by our parents. Lots of volunteering, lots of giving, lots of understanding different capacities that people in our community had to meet their own needs and how to step in and do that. So I am a nurse now, but I was actually a social worker before I was a nurse, which kind of lines up with all of that. And my mother was a nurse, and I'm happy to say she is still a nurse, although she's not licensed at this point since she's 96. But she's living her best life, and good vision is part of what's allowing her to do that into the mid 90s and past. But yeah, after I worked in social work for a while, I became a nurse and then eventually a nurse practitioner, and typically have always worked with historically excluded or underserved communities.
So tell me a little bit more about global nursing and how did you get into that? Because I know you travel all across the world.
Hmm.
So what does that look like? How did you get into that?
I I won't give you more history than you need, but the Reader's Digest version is I had always wanted to be in the Peace Corps. And for various reasons, when I got out of college, they didn't need people with the skills I had, or more to the point, didn't have. And so sometime later, after I became a nurse, I thought, oh, I've got real skills now. I could do that. I was old for a Peace Corps volunteer at the time. I was in my mid 30s when I went. So I was already in the midst of a career. But it was something that I had really always wanted to do. And the space opened it up in my life for me to be able to do that. So I worked on public health projects in Senegal, West Africa, with a lot of people who were really younger than me. um, but had a wonderful time beginning to understand more about culture, not just the obvious things, but uh, an example I can think of is in my head, I was signing up for National Geographic Africa. Where I went was really the Sahel. It was sub-Saharan Africa. It was a desert. You could not have convinced me there was anything beautiful about that lunarscape I was living in. And yet, if I was open to it, which I was, I came to really see, value, and understand the beauty in that environment. And I couldn't have done that without help from my Senegalese national friends.
Yeah, it's a great example. So, why is health, specifically eye health, so important to you? Because you've been an advocate for it for a long time.
hmm Well, all politics is local, right? So first thing is it hits home. I have
Mhm,
family members who, one who has a serious eye illness, and I have many family members who had uncorrected and undiagnosed refractive errors.
mhm,
Um, now, the uncorrected refracted errors, hopefully that's an easy fix, right? We have the skill and technology to diagnose it and then create a pathway through contacts or glasses or patching or whatever we're going to do. Um, but I will tell you, one of the people who had the uncorrected refractive error was my son, and I was with him at his annual checkup, and he passed the vision exam. And I realized it was that the providers, meaning at that point it was the medical assistants, were doing the absolute best they could with everything they had, but they truly hadn't been trained because he, uh, like most young children, was trying so hard to please them and
mhm,
pass that, he was leaning right way forward, he was turning his head like that. And although I wish that hadn't happened for him, that I would have caught it earlier, it was great because we caught it then, and it also gave me a chance to talk with people about some different ways to think about approaching that. So that was one thing, family members. And then the other thing is for many, many years, I worked in school health and public health. And in both those assignments, we did a lot of care for all kinds of care for students. But one of the districts I worked at um, was in a low resource area, lots of families with less income, um, not very, the city wasn't super ethnically diverse, and the school district definitely wasn't. It was mostly underrepresented folks. Um, and so I walked in there my first day and I was like, oh, there's so many great things we could do. And the first thing I realized was these kids are having so much trouble with reading and some of the achievement issues. That was just so obvious to be low hanging fruit. And honestly, there was a bit of naivete with how I approached that, I think, but it could never have launched the way it did and still be successful, honestly, without partnering with Prevent Blindness. And that's how I became involved with the organization. I called them up and I was like, I know you're the premier folks in this. Here's my situation. I've got 125 schools and, over 100,000 students. Can we figure this out together?
mhm,
And so it wasn't just one of those, yeah, we're partners and we're each doing our own thing. It was a true collaboration and a true partnership that's lasted for many, many, many years.
mm. That's good. That's one of the reasons I think I love this job, um, because I really do believe, and I think it's across the affiliates and the national organization of collaboration, true partnership, really sitting down to talk about what are the best solutions and how do we work together to bring them to the community. And that's something I think that we do really well.
I agree. It's a true strength of the organization.
Yeah. Yeah. Okay. So, what are you passionate about professionally and
And
personally?
okay, well, that makes it a little harder, of course. Are we PG 13 or what's our designation?
All right. We'll go with PG 13.
Okay. Well, professionally, it's about basically trying to do everything I can to make things as equitable as I can for everyone. And when I say equitable, I'm not necessarily talking about income or ethnicity, although those are clearly involved. But I'm even thinking about um, we know so much now about loneliness and
Mhm.
social isolation and its impact on all aspects of health. So when I talk about equity, it's sort of trying to level set all the things that impact somebody's life. And nursing is a very good place to do that because we work across so many domains.
Mhm.
We're often the only healthcare clinician that people see for an extended period of time, whether it's an RN or a nurse practitioner. Um, so my whole career really it's been about that and also recognizing that I have the teeniest tiniest of parts in doing that, that there are so many doing so much more.
I don't know. I think I'd have to challenge that. You've done quite a bit, Kathleen.
So
Oh,
personally, what
yeah.
I tried to evade personal.
Yeah.
Well, I thought I made a note for myself. I was checking my paper, but I really didn't. Uh,
Well,
honestly, go
I,
ahead.
I, my observation, and one of the things that's both personally and professionally important to you, is opening the door and helping those that are coming after you, especially women, but to really help empower people, teach them. I believe teaching is important to you,
Very.
mentoring. And so when I think of you, both personally and professionally, that is something that comes to mind, is that you are an amazing teacher, but it really, learning and teaching matters to you.
It does, and thank you for saying that because I don't think I would have thought to say that about myself or necessarily noticed it, but I think it's accurate. I think you articulated it very well. You'll have to go with me everywhere I travel and
But
talk
that
about
means I
these.
get to travel with you across the world. I'll
Yeah,
sign up for that.
perfect.
All right. What makes you work hard every day? And I know you work hard every day.
Yeah, I think these days everybody does really.
Hmm. Yeah.
There's so much to do and so much less resource to do it with.
Yeah.
Um, and I just feel like, well, at the very basic level, I love that feeling at the end of the day when you worked really hard and you're tired and it's a good
Yeah.
tired, whether that's physical labor or, you know, head labor or
Yeah.
working with people.
Yeah.
Um, but I really do feel like there's a limited amount of time to make a difference. And we only have however many hours in the day that we're working. And somebody who perhaps sits in a place of privilege can put some things off until tomorrow. But persons who don't have that same privilege, sometimes stuff needs to happen now, or it
Yeah.
needs to even happen yesterday. And that I think is a very important motivator. And it's why a lot of the people I work with work so hard. um, we just want to do what we can to make everybody live better longer, wherever that
Yeah.
is, and whatever that looks like.
Mhm. I love that. Live better, longer. So, who inspires you?
Definitely the people that I hope I'm serving well. Um, I work in a free clinic with unhoused persons and work with a transitional living, supportive living situation for people exiting homelessness. Um, when I see people I work with show up every day, no matter what is happening in their lives, and I'm talking about the patients, really,
Yeah.
not not the other providers. Uh, uh, I can't even say anything else about that except what it is.
Mm.
Um, yeah, it's really important to do whatever it is you can in the time you have.
Mm.
Just make the time count. And I
Yeah.
think most people in the public health space, in the vision care space, in healthcare in general, teachers, I've seen this tremendously with teachers. They are just trying to get that last little, what can I give today that, you know, is going to change things for somebody.
Yeah. And I love that because I think it's interesting because outside of the vision world, I don't feel like there's necessarily this urgency, right? But if you're in the vision space, the eye health space, you understand if we operate with urgency, if we put these interventions into place, if we can change the path now, we can change significantly the outcomes in the future. And that for me is why I love, it's another reason I love this space and this job, because truly we actually can change the outcomes if we do it now, if we act now, if we put those interventions in place right now. So I think it's really, on point to do what you can now.
It's absolutely true. And I think you expressed it beautifully. I mean, vision issues that aren't paid attention to or corrected, if they're correctable, hopefully. I mean, that goes to the social isolation I was just talking about. Developmentally, can you interact with your peers in the way that you would if you had your full abilities? Is it impacting your reading, which could impact further education? Further education is going to affect perhaps what career you might pursue and your economic development. And that personal economic development affects the whole community. Because if we have a number of people who've missed that opportunity to get better so they could do better, uh, it affects the whole community.
Yeah. So, did you always want to do this? Did you always know, okay, this is the field I want to be in?
No,
So,
no, no. As I mentioned, my mother is a nurse, and one day I sort of asked her what a nurse does. I mean, I knew generally, but I wanted the detail. Do they empty
I'm
bedpans? Do
shocked.
they? Yeah. And she told me, and I was like, well, Mom, you're never going to catch me doing that.
Never say never.
Right, right. I wanted to be so many different things, which I think is wonderful because I grew up in the sort of the beginning of feminism. And so it was
Yeah.
wonderful to be able to contemplate so many possibilities and probabilities. But I think that early training from my parents about some of the most important, personally important, and community-wide important work you can do involves helping others meet their own goals. It always sat with me. So yes, I became a social worker, and I worked primarily in long-term care. And then I realized social workers and nurses actually do a lot of the same activities. The only ones that are different are the physical care. Case management is a big part of nursing. And I thought, I'm going to put on my thinking cap here, and I bet you I can do all of this, and I'll have probably more opportunities to do different kinds of that care, which again is one of the benefits of nursing. You can try so many different areas and types of care and ways of being with people. Uh, yeah, so I came to it the long way.
Like that. What was some of the best advice you received during your career?
Um, Honestly, when I was kind of mid-career when I got this advice, but I thought it was really sound. Somebody said to me, "Stop all this stuff you're doing. If you want to last, you've got to pace." And I said, "I don't even know what that means." Like, what are you trying to tell me here? Um, but I think it was really good advice because it's not about laying back and not doing things. What it really does is give you that however many seconds or minute pause you need during the day, during the week, during a career to be really thoughtful about where your time and energy goes and not chasing email, every time something pops up on your screen, responding to that and the next shiny object that goes through the space. Um, so I really began to understand it in a way of how to shape work, and that um, you're more productive and can offer more to your colleagues and your community if you're strategic about your time.
Yeah. 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 That was great advice. Great advice. So now you've been doing this a little while. What
Mhm.
advice would you give?
Definitely that.
Mhm.
I would definitely give that advice. Um, Advice I often give people that are early or late early career is to shape what you want for yourself. Um, because I think sometimes we're in a culture where we're waiting for a superior or an organization or somebody to tell us how our life is going to look that year or in this assignment and of course we all need to respond to those kinds of pressures and requests. Of course, I
Yep.
mean, we have to have some organization. But I think it's really powerful to think through for yourself what it is you want and what you want it to look like,
Yep.
because you might have some brilliant idea to involve yourself in the organization in something that nobody's ever thought of. And so you thinking about that for yourself allows you to come to the table with some ideas and how you see this work life looking for you. And then, of course, it's always a negotiation, but
Yep.
it's important to at least verbalize for yourself what's important to you and how you can contribute.
Those are very wise words, Kathleen. All right. So we know that you met Prevent Blindness early in your career. How did you get to Prevent Blindness Texas?
Okay, well, I had worked with Prevent Blindness Wisconsin and the national team at Prevent Blindness, and I moved to Texas to work at the University of Texas Medical Branch.
Yep.
And of course, I know they say Prevent Blindness is a big family, but it really is because right
Yep.
away I was contacted saying, hey, you're in Texas now.
Yeah.
Yeah. So it was very easy for me to say yes to that because I believe truly in the mission and the organization. And I have been amazed and honored to be able to watch the organization's growth and change. That, when you think many, many years ago, it was pretty much screening, which is
Yeah.
so important as we've
Yeah.
already discussed, but screening.
Yeah.
But now it's about how do we help our community with resource management? How do we advocate for sufficient resources at the state and national level to meet eye health needs of our community? How do we partner with people, to your point? How do we build collaboratives so that none of us small not-for-profits are trying to shoulder the burden ourselves? We have the buoyancy of being part of a collaborative. And I love that about the organization. Absolutely love it.
Yeah, I really, I mean, I deeply believe, it's those group of minds that come together that we may have thought should be this way, and then an idea comes forward and it's so much better and so much more doable. But you don't get there if you don't have those conversations. You know what I really love and what has been really fun to watch over the last almost decade is we started out kind of like with these partners, right? Very specific, okay, makes sense. But now we've gone with all different partners across communities, and I love that. I love that we stepped outside kind of this box, right? But really, because vision touches everyone, and so being able to find those partners who could get creative too and innovative has been really exciting, and I think it's been part of one of the reasons we've grown so much, but also why the demand has grown, because people now
Yeah.
understand and want to invest in eye health in their community, and we can help them do that, and I think that's been pretty exciting.
I think it's so important, and exactly what you said, it affects everybody. There are some diseases or conditions that don't affect everybody, but and I personally have seen one thing that I found very interesting that I didn't have an awareness of this before, and I should have, is I think a lot of people go through life that if they don't have something diagnosed in childhood or adolescence, they think they're good for the rest of time. And then to have that horrible awakening of, wow, I'm advanced middle age right now, and I've got a condition with my eye that I never thought would happen to me, that
Yeah.
I didn't think about, that I don't understand. So
Mhm.
much of the work Prevent Blindness does with community and multiple partners all spreading the same message is so valuable.
Yeah. Yeah, because basically, right, if you age, you pretty much are going to deal with some kind of eye issue, right? Now,
Hmm.
most of them are solvable, but you are
Right.
going to deal with an eye issue at some point.
Yeah.
All right. So you were on the board for us, and
Hmm.
then you've been the chair of the national organization for their board.
Hmm.
So just a little bit about what those experiences were like for you. But then I'm really interested in, when you serve in those leadership roles, and I know you, so I know it's something you took something away from that you learned, right? Because that's how you are, that's who you are. But I'm just curious, like what did anything shape you, or you look back and you think that really changed, something about my leadership.
Hmm. Uh, well, I think both at Prevent Blindness Texas and in my national role, and I've been on multiple committees at the national level too, but I think it is very hard to be one of the few women, if not the only woman in the room in a leadership position with not all men,
Mm-hmm.
but, and I'm not, I want to be absolutely certain to say none of those individuals made me feel unwelcome, unappreciated. Everybody was so gracious and wonderful. So it's not the individual people, it's the societal and sociological feeling you have as a woman in charge of a large organization. Um, that was very intimidating to me. And uh, I'm not easily intimidated by,
Gonna say, no, you are not.
no, but I was like, how can I manage this so that I only speak when I need to, but that when I do, there's something meaningful that comes out of that hole in my head where my voice is. Um, that was a struggle for me. And one of the things and sometimes I had to discuss unpopular things.
Mhm.
I don't necessarily shy away from that, but I also want to make sure I always try to frame it in the way that doesn't distance other people from the issue so we can come together and talk about it even with differing opinions.
Yeah.
But honestly, that was something big that I took away. I was in every educational environment you can think of where women were celebrated and it was, you can do this, you have all these skills and abilities. But when you're actually there and you might not have been in that role before, you have to do a little inner reckoning.
Yeah.
And so I did, and it was all fine. But honestly, that's advice that I give to other women stepping into maybe a bigger role than they've had before in some capacity that your fear shouldn't be about doing it. Your fear should be about not understanding why you have fear, and then work on
Mhm.
that to get it to the place you want it to be.
Yeah. It's good. That's kind of shocking to me. I'm surprised that so from the outside, I would have never guessed that, because you certainly led always with confidence and direction and knew exactly what you wanted to say and where you wanted to go. At least that's what it seemed like when we were in those meetings. So, but that's really interesting. But it is true. I think it is great advice. It is. I think well, with all things, right? When you do something that's a little scary, right? Why is it scary? Is it because you don't think you can do it, or is it, where does that come from? So, but I think well, you do know that I worked with an executive coach for this past
Hmm.
year, and it has been incredible. She's incredible. But we talked about some of those things when I was thinking about, really where does the organization go next, and do I have what it takes to go there, right?
Hmm.
And there were some really tough conversations about, I have all these skills, but it was in the back of my head, right? well, I don't know if I can do this. Well, why? Why wouldn't I have been able to do this? Right. And so, really is, I think that is great advice, great insight. Kind of a little reckoning is required when you step into those bigger roles, but take them because they're amazing.
Yeah, absolutely take
Mm,
them and reach out to your
mm,
trusted friends and
Yep.
colleagues, right?
Yep. Yep.
Um, they're the folks that will tell you the truth. You're
Yep.
overthinking this. Go, do it
Yep. Yep.
or step back. You might want to think about that for a minute or
Yep.
yeah, well, I'm glad it looked so seamless. That's the goal. Uh, and eventually, of course, I did get there, but uh, yeah, and it was a tremendous opportunity to have, and I was so grateful to do it.
You did it beautifully. All right. So let's talk a little about eye health. And
Mhm.
so, what comes to mind for you when we say eye health? And what do you think comes to mind, kind of the average person when we talk about eye health?
So, mm, I don't know if I've ever been asked what the average person thinks. So, so excuse me, humanity, as I'm speaking for you, um, without your input. Honestly, I think when most people think vision, they probably think two things: eyeglasses or contact lenses or correction, or not having any vision,
Yeah.
um, and not being able to see anything. When I think about it very differently. Um, as I said, I work primarily with unhoused persons,
Mhm.
and we're in Galveston, we're in southern Texas, right by the Gulf. There's nothing but sun and reflection off the water and reflection off buildings. Most of our community members don't have eye protection.
Mhm.
They're
Yeah.
they're out there all the time,
Mhm.
and there's a definite long-term impact from that.
Yeah. Yeah.
Not only just um, the immediate impact. We were able to cobble together some funds to get eclipse glasses because we were in the pathway
Mhm.
for the big eclipse. So that was a benefit. Um, I see people trying to do so much. Now, we all have the benefit, many of us, not all of us, many of us, to have an iPad or some tablet and a phone and a computer. And so whatever our eyes are feeling that day, we can use which device
Mhm.
is more comfortable.
Yeah.
Most of the people I work with, if they have anything, they're working off a phone. So
Yeah.
imagine trying to fill out government forms like that on a phone or that sort of thing.
Yeah.
It's so difficult, for their eyes. Employability is affected if they don't have readers and they're of a certain age, and
Yeah.
they've got presbyopia. That's what I think about. It's about how does this affect someone's, not just someone, all of us, me, you, everyone. How does not having good vision when we need it affect our ability to care for ourselves, to interact with others, to keep ourselves safe? You
Yeah.
know, if you're walking, I actually literally saw this one time. It was many years ago, but I was walking and there was a person with a white cane who was walking and I didn't even realize what had happened till it happened. But there was apparently some sidewalk work going on, and there was a giant hole in the sidewalk. No cones, nothing. That person fell in that hole.
Mm.
I mean, we don't think about it if we're sighted.
Right.
Uh, so there's just so many ways it impacts how you live. If something as simple as I want a can of soup. Well, I'm sighted, so I can just get in my car and drive to the
Yep.
grocery store because I can see all that. I know which door to push or pull to get in.
Yep.
Uh,
Yep.
I can look at the 80,000 cans of soup on that shelf and decide what I want, and I can look at the fine print to see what's
Yep.
in it. Something as simple as having soup. There's so
Yep.
many steps where vision is involved in different ways.
Yep. Yeah. And it's a great example of all the different things that your vision does that we take for granted, right?
Mhm.
I mean, to your point, from walking and being able to see what's in front of us, right? Or being at the grocery store. I think it's a great example of just the daily things, the normal things we do, and how when your vision is impacted, that all changes for you.
Yeah.
So what what advice would you give someone about taking care of their eyes?
Well, don't wait. Number one,
Yep.
I think a lot of us feel like we're busy and so we'll put that off or something else. We tend to be very good with making sure other people in our lives get taken care of, children or a partner or parents or somebody elder. But we're often not as generous with ourselves in terms of meeting those needs. So one is don't delay. And don't delay means both for your annual checkup, because as we said before, it can change just like everything else in your body can
Yep.
change. And
Yep.
just like you go to the dentist every 6 months, eye exam every year, right? So one is don't delay. And then two is to really reach out to all the resources that are available. There's many. Prevent Blindness is a great one. What should
Yeah.
I be eating? Should I be taking any particular supplements or not? Would and Prevent Blindness is not a healthcare provider. They're not giving healthcare provider messaging, but they do present on the website some of the best evidence-based strategies for maintaining and preserving eye health. So, are you making sure that when you're working on your computer 15 hours a day, that every 20 minutes you take 20 seconds and look at least 20 feet away so that your eyes are not impacted? We have a tremendous problem with myopia
Yeah.
now that is only getting worse
Yeah.
because people are on screens too much without allowing the eye to refocus.
Yeah. So talk a little bit about, I mean, we've alluded to it, but talk really about kind of overall health and really the connection to vision, but kind of through the lifespan, right? I mean, just high points. So early on, the importance of eye health is development, right? So
Hmm.
kind of talk just from that frame a little bit of I what I think, eh, calling to your earlier point, but not everybody connects all these different pieces throughout their life to their vision health, right? But
Hmm.
depending on what medication you take could impact your vision, right? Depending on what disease you have. So just talk a little bit kind of those components, so that the
Sure.
audience has an understanding of kind of why it's so important to go every year because of all these different factors.
Okay, well, starting with development, of course, I think we've talked a little bit about how important eye screening is for not only for uncorrected refractive error, but for amblyopia, of course, with if caught early, treatment is very, very successful. And it does interact with all other aspects of yourself. I think of brain health. There's so much careers in the future will be so different because it's going to be all knowledge based. And imagine if you can't see some of the earliest developmental things, right, are matching or fitting shapes together. That starts that whole process of kind of organizing thinking and being able to see systems and how things work together. If you cannot see, it's going to take you longer to develop
Yeah.
that, or you might have some deficits there. For adolescents, they have such growth spurts and they can definitely have vision changes related to that. Even if they're a child who hasn't had any problems before, the shape of the eye changes. Uh, it, it's incredibly important. And then getting more into people I resonate with, later adulthood. Uh, some of the things that we can treat very effectively, chronic conditions that lots of people have, uh, diabetes, heart disease, thyroid disease, or people might think of it as Graves' disease, which is the one that primarily affects the eyes. Um, those illnesses have serious consequences for your eyes apart from the other systemic issues that they cause. So diabetes, of course, affects the kidneys, the heart, the circulatory system. Well, of course, we have circulation in our eyes.
Mm-hmm.
Um, and if that disease is not managed well, there is a significant possibility of loss of vision because of retinopathy in the back of the eye when that's not well controlled. And with thyroid eye disease, it's People may have seen photos of bulging or that sort of thing. There is true pressure on the eye. All of those things sort of prevent you from being who you are until they're corrected. And development, this is grossly oversimplified, but development from little all the way to the end is about you figuring out how to be truly who you are.
Mm.
That's what all this stuff is. And so anything that gets in the way of that, you learn something about yourself because you figure out how to work around it,
Yeah.
but you don't want something that's going to stop it or halt it.
Yeah. Especially something that can be helped, right? Something that can be solved.
Absolutely.
I mean, that's
Or
that's
prevented.
right.
Yeah.
Absolutely.
Yeah.
Absolutely. All right. So, kind of the last section. Tell me about, talk to me about, healthcare in general. I mean, you've been in the healthcare world for a long time. And what do you think the biggest difference is kind of from global health to kind of our healthcare system? What could we learn from global health or implement into our healthcare system based on what you've seen?
Well, it's interesting because no matter where you are, some of the things that we've talked about ring true in low resource environments across the globe and here at
Mhm.
home. Collaboration, like true collaboration. So we have a lot more resources than some other places, but sometimes we still don't have enough. So how do you use a true collaboration to figure out how to meet a whole community or a whole areas or a whole nation's need?
Mm.
That is number one. Number two is just figuring it out on the fly. Clinicians who typically work in underserved areas, there's a lot of that. There's a lot of MacGyvering. And of course, we would never want to and never would sort of just be cavalier about what somebody needs. But if we have the ability to fabricate something that's going to help a condition and be safe, we do it. And I think that happens here as well. Um, I think some of the access to care is better in other places. Um, I think some of the preventative service aren't at the level we have, but one thing that I think every country is really trying to do is help people practice, healthcare providers practice at the top of their license, right? So if you're licensed to be an RN, there is a lot you can do. So let's not collapse that down to you're only going to do this or that. And that's true for everybody, not just RNs, PAs, physicians, nurses. Practice at the top of your license because we'll all be able to do more for people who need it if we can do that. That I think is something everybody's working on. I will say there's a term, glocal, that's used now, global and local, because so many of the issues that people work with in global health are right in our own backyards here. And it's a community that doesn't have access, who has limited resources, who doesn't have a lot of healthcare providers. So I think it's really a lesson to high income countries that and I think it's definitely changed. In the 60s or 70s or probably even 80s, it was about the big countries going in to save the little countries. And now it's much more of a recognition we all have problems.
Yeah.
We have them right in our own backyard. How do we solve them together?
Yeah. Yeah. So, what stands out to you, one of the challenges you've had through your career that kind of shaped you, that you thought, I don't know if I can get through this, and you did, and now looking back, it really kind of shaped, your path.
We only have 45 minutes, right?
Yeah.
Uh, um, well, I think one was deciding to be a nurse.
Mhm.
That is a big decision and it's a lot of responsibility. And I wasn't sure I was ready for it. I think you have to be in the right kind of place to understand what you're taking on. Um, and I will say some of what has always been a challenge to me is I personally have never practiced in a hospital.
Mhm.
My entire career has been in public health or in free clinics, or I teach now and participate in this free clinic once a week. So I have a very different background. And often in nursing, you'll hear people say, well, I need that 1 year of hospital experience. And I always say, well, tell me, let's start with what do you really want to do? Tell me what you really want to do. Because sometimes that would be the answer, but other times it's not. Um, I I don't even know if I can say this on the podcast. I'll say it and you can cut it out if it's not right. I think one of the biggest challenges I had in my career was I was working in a school district and we had data from both the CDC and the Youth Risk Behavior Survey about the significant issues with sexually transmitted infection among our students, um, the age of sexual debut in our students, and there really was nothing we were offering at the school level um, in terms of process and product to help
Mhm.
them. Of course, they all
Mhm.
get health education and all of
Right.
that. And so I actually embarked on a project to bring prophylactics into the school, all schools, all high schools. And I was very clear that it was not about pregnancy prevention. It really was about this public health intervention. And that was really the frame we put on it. But that was a very long process, ultimately successful. But many people told me I should have not have taken that on. And there were times I thought, oh yeah, maybe I shouldn't have. But you can't unsee. If you see something, you cannot unsee it. And then you're kind of compelled to keep doing it.
Solve the problem.
Yeah.
Great. Yep. 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 So, so looking at our industry and both eye health and kind of overall health. So two things, what do
Hmm.
you think, what do you see over the next 5 years? And then the follow up to that is, are you worried about the nursing shortage as we look over the next 5 to 10 years?
Hmm. So for eye health specifically, I think so much is going to be done with technology and
Mhm.
AI.
Yeah.
I My brain explodes when I think about
Yeah.
all the possibilities,
Yeah.
especially for vision. I mean, for lots of
Mhm.
health issues and organs and systems, they'll
Yeah.
come up with things. But vision is ripe for that
Mhm.
because of
It's
all the work that's already been done and how life changing that can be. I am very worried about the nursing shortage. We had a lot of nurses leave the profession during
Mhm.
COVID.
Yeah.
Um, and everybody worked hard. So I don't want to say only everybody worked hard, the
Yeah.
physicians, the lab techs, the nurses' aides, the nurses. But I think there's something fundamentally in our system that hasn't helped us understand how to best appreciate and compensate their value to the healthcare system.
Yeah.
And when people have so many more career opportunities now, 60 years ago, it was nurse, teacher, nun, or secretary.
Yeah.
Now it's astronaut, you know,
Yep.
biosafety engineer. There's
Yeah.
so many wonderful things that people can do. Uh, so I think we need to help really the community at large understand the value and benefit of nursing to the whole healthcare system
Yeah.
and think about ways to keep people engaged in it. Um, yeah, it's very important. I will say something about Texas. Uh, I We have so many young men come in as students, and I've not seen that level. It's certainly not gender balance at this point, but it's very much different than other parts of the country as far as the number of men. And Texas also, well, I won't say Texas. I'll say the school I work at. We have a very diverse student body, which I love because the Houston Metro is such a diverse metro with so many people culturally, ethnically, linguistically needing so many things that it will be great as a community if we can provide all that.
Yeah. Great. Great. So if there's one thing you could change for our
Mhm.
industry right now, what would it be?
Well, it's super pie in the sky, but it would be complete access for
Mhm.
everyone
Mhm.
to have a basic level of care. And if something is identified in that basic level of care, that there's an opportunity and a mechanism for a person to have that resolved.
Yeah, a pathway forward.
Hmm.
Yeah. Yeah. All right. Any last pieces of advice or parting words for our audience? If they
I
remember nothing else, what's the one thing you want them to take away?
donate to Prevent Blindness Texas because you're the ones getting the work done.
I,
Honestly, that is something I would tell people. I love working with the organization, but I also love supporting the organization,
you
and
do. You
they're
do.
doing amazing things. So
Yeah.
that's what I don't think I have very much sage advice, but no, I'm just so grateful to have the opportunity to work with your team and the national team. There's so much need. There's so much need, and you are meeting it with so few resources. I can only imagine what you could do with
Yeah.
more. Yeah.
Yep. Me too. I'd like to find out.
Yeah, right.
That's
That would
my
be a,
dream.
yes, that would be a very good problem to
Yeah,
have.
it would. I do think what you said there was incredibly important in the value of nursing and how important they are, not only to the systems, but even especially like the school systems, right?
Hmm.
I think most families don't realize how much those school nurses do every single day that help our students find success. So I agree with you. Nursing, I think, is so incredibly important, and we have to find a way to really honor the value they bring to the table across the board in whatever
Yeah.
community, however they're serving, but they are so critically important.
Absolutely. And I think you really touched on it with school nurses.
Mm.
If you're a nurse in a hospital, uh, and we need them there too, so I'm
Yeah.
not saying don't work in the hospital. But if you see something that you don't think is quite right or you want a second opinion, all you have to do is go down the hall and ask
Yeah.
somebody to come and take a look. When you're in a school, it's you.
Yeah.
That means you have to be an expert clinician, expert diagnostician, expert case finder, expert, case manager. So you're
Yeah.
right. They do an incredible amount.
Yeah. And a really strong communicator, right? Because a lot of
Hmm.
times it's that nurse that helps parents understand what the issue is, why it's so important, how to solve it, and then continues to follow up until it gets solved. And I think
Yeah.
that's, what worries me is looking at the shortages that are happening across the board in the school districts too, where you now have
Yes.
nurses handling 3 campuses, 4 campuses, and they're still responsible for everything at all of those campuses. So I think anything we can do to help support our nurses is incredibly
I
important.
agree. I agree.
Well, thank you so much for being here, for everything you do in the space, especially for Prevent Blindness and for Prevent Blindness Texas. You are incredibly valuable, and just a great person, Kathleen. You really just you are you. I have learned so much from working with you, personally and professionally. So thank you for all you do and for the difference you make all
Well,
every day.
thank
So
you so much. And thank you for asking me to be part of this, even though I don't like talking about myself.
I know.
Okay.
I know it's a stretch, but we don't take those leaps. We
Okay.
don't,
That's right. It was
right?
a growth experience. Yeah.
It was. It was. All right. So thank you to everyone who's joining us. As Kathleen said, you can always support us. But there are so many ways to get involved with PBT. You can volunteer, you can come to an event, you can become a screener, you can become an advocate. You can help us educate in your communities. We are always happy to meet with you and talk about how you can be a part of the PBT family. So don't hesitate to reach out. And remember, we always want to know what your vision is. So don't forget to follow us. We are Eyespiring, Prevent Blindness Texas. Thank you. Have a great day.